Welcome to Founder Tactics, a podcast about entrepreneurs and the communities that shape them. I am your host, Julia Lucidi, and today we'll be tuning in to a live recording of a panel at the Fort Lauderdale Tech Meetup. I moderated a discussion on shaping the future of personalized healthcare with three health tech leaders who are transforming the industry by tackling bureaucratic challenges and paving the way for a more efficient, patient-centered healthcare system. Our expert speakers included Bernardo Perez-Villa, Senior Engagement Partner at Cleveland Clinic, one of the largest healthcare systems in the U.S., with 80,000 caregivers, 23 hospitals, and 276 outpatient facilities in locations around the globe. Also on the panel was Samson Magid, co-founder and CEO at HealthSnap, a virtual care management company that partners with healthcare systems and provider groups to monitor and care for patients from their home. HealthSnap is one of the country's leading integrated virtual care management solutions, powering over 150 health systems and provider groups, having also raised over $35 million in venture capital to accelerate their strategic growth. The third expert on our panel is Igor Couto, CEO and founder of Sofya, a real-time clinical reasoner that intelligently automates the workflow of healthcare professionals, currently processing over 4,000 consultations daily. A Brazilian bootstrapped startup that is now expanding into Chile and the United States. Before we get started, thank you so much for tuning in. We're really excited to have you join us for this incredible panel discussion, and we hope that you enjoy it. Don't forget to subscribe on whichever platform you are listening to, and make sure to share this podcast with a friend. It is the best way that you can help our community and content grow. So without further ado, let's jump in. Okay, so let's get started. I would love to start with a round of introductions. We have three really incredible speakers here tonight. And I would love for each one of you to not only introduce yourselves, but take your time. Don't feel like you have to introduce yourself in 30 seconds. I would love for folks to really get an understanding of who you are professionally and where you are here today. So Bernardo, would you kick us off?
There you go. There's no better way to start than with my heavy accent to have an amazing echo. So my name is Bernardo Perez-Villa. Thank you so much for inviting me. Creating a community is not easy. So congratulations. Building your business is not easy. Most of the people here are looking for the secret sauce of how to create a business. And I'm a cardiologist by training. I'm a heart failure specialist, born and raised in Argentina. No hard feelings. Again, Brazil, we were on the World Cup lately. Don't worry. We're fine with that. And then I moved to Spain, did my residency as a cardiologist. Second year of my residency, I said, this is not for me. Thank you so much. I was about to quit. I was in the bus stop coming back home, and I said, I'm quitting tomorrow. But there was a music store in front of the bus stop, and I said, I always wanted to play drums by John Bonham, the Led Zeppelin. Those that are more than 20 years old, they don't know perhaps Led Zeppelin, cool band. And I said, I'm going to buy 2 sets of drumstick, and I started drawing. I came back home, I started drumming. It's going to make sense, believe me. And then that led me to when YouTube was starting, because YouTube didn't exist before, so many people that are in the audience. And I finished my residency thanks to playing drums. And after that, I did my master in healthcare economics. I did a background in statistics. And I said, well, you know what? I want to create my own thing. And one of the major struggles as a physician is that I spend 80% of my time doing bureaucratic stuff. And we use Alexa with some people that I met. And we created this startup that collected clinical history automatically. And we weren't successful. I invested my money, I lost my money. And here I am. But that opened me the door to come to the United States and work for Cleveland Clinic as the senior engagement partner for the technology transfer office. And I describe my job as being I am Mr. Wonderful. 2 differences, more care, less money. So what I do is I vet your ideas of clinician. I say, no, we are not going to invest so tight. Give me your royalties. So that's what I do.
And the Cleveland Clinic is the second largest hospital in the U.S. You guys have 80,000 caregivers. Is that right?
We have 80,000 caregivers, 15,000 caregivers here in the Florida region, 5 hospitals, 33 ambulatory care centers, 1 bench research center. What does it mean? We're busy.
Perfect. Thank you so much. Samson?
Hey, good evening, everyone. My name is Samson Magid. I'm the co-founder and CEO of HealthSnap. Different than my co-panelists here, I did not go to medical school, even though that was my lifelong dream. I was a pre-med as an undergraduate at the University of Miami, and I was a double alum at UM. I'm a former New Yorker, but I've been here for about 14 years, so I am now a South Floridian resident, and very proud of that, building companies in South Florida. My lifelong dream was to go to medical school, be a physician, and I love science and medicine and helping people. And as an undergraduate, I was studying exercise physiology, which most people think of as more like personal training, health and wellness, but our program was all pre-med, and we were learning about chronic conditions and how chronic conditions account for 90% of all of our healthcare costs in our country today. And if I asked the room right now to raise their hand, if you know someone or if you've been personally affected by high blood pressure or diabetes or heart disease or cancer, everyone would probably raise their hand. It affects most of the country. It is a rapidly growing problem, and it's an epidemic. It's actually a global pandemic. And so I was doing research as an undergraduate on trying to change the chronic disease landscape in our country. And flash forward a couple of years, I took my MCAT. I'm ready to go to medical school. And unfortunately, my grandfather passed away as I was set to go to medical school. He was my role model growing up, and him, like most people in our country, had multiple chronic conditions his entire life. He had a heart attack in his 40s. He was diagnosed with type 2 diabetes in his 60s, another heart attack in his 70s. And sorry for the sob story on a beautiful evening on a Tuesday night, but that became my motivation to say, hey, there's a much bigger opportunity here than just becoming one physician and working with one panel. We can actually change the way that chronic conditions are managed. So I, as a very naive 22-year-old, decided to forego medical school last minute. I convinced my best friend and my professor, who we were doing the research with at the University of Miami, to take the research and spin it out and start a company, and that became HealthSnap. Flash forward almost a decade later, we are venture backed. We most recently raised a Series B. We have over 500 employees. And we work with organizations like the Cleveland Clinic to help them remotely monitor and manage patients with high cost, high risk chronic conditions in the home. So we do remote patient monitoring, chronic care management on all these virtual care management services. We built a software platform, a device shipping logistics arm, and a care delivery arm of the business as well. And so we built it from ground up, starting when I was 22 years old with my best friend. And it's amazing to be able to see the growth in South Florida, especially coming out of UM when there was literally nothing and not a single dime of venture capital. People would look at you crazy to try to build a company in Miami and South Florida. And look where we are now with a room packed of people trying to learn more about innovation. So kudos to everyone, and happy to share more about our story. Yeah.
And HealthSnap is one of the largest remote care companies in the U.S., isn't that right?
Yeah, we work with over 100,000 patients in 33 states currently, and work with 4 of the top 25 health systems. Cleveland Clinic is still on our list. We haven't worked with you guys yet, but we'll go on Shark Tank and we'll make it happen.
Awesome. Thank you, Samson. Igor?
Thank you, Julia, Samson, and also Bernardo. I'm Igor. I started my career 23 years ago into the airline industry. Back then, we built every system around the airplane. The only system we didn't touch was the airplane and the embodied computer. And I developed a deep sense of mission critical applications, like not only the booking part of the airline, but the balancing, the intelligent routing, the best time to buy fuel, and how to support pilots on the decisions to the flight plan. This in Brazil. So I had to have at that time the same training as the air crew. So I developed a sense of how can we make decisions into a high pressure environment. So my school basically was working with airplanes. 10 years later, I founded a company specialized in big transformation, digital transformation projects like big financial institutions in Brazil. And one of our customers was the second biggest hospital in Brazil. And I saw and lived many of their pains during healthcare. And my dream was how can we apply cognitive computing and bioinformatics to help to develop like a clinical mind to support physicians to give better healthcare delivery. So I founded Sofya 3 years ago, and we are at that journey. We started in Latin America in São Paulo, and now we are expanding to the US. So I feel very welcomed here by Julia and other community, because I really dream with an era of personalized and precision medicine. So, and with the support of these new intelligent systems.
And tell us, how many consultations are you guys processing per month right now?
Right now in Brazil, we are doing 100,000 consultations per month with help of the AI, and we are growing very fast. And we just closed our first American deal, and also we are expanding the operation to Chile, and probably we'll close a contract in Chile as well. So I'm very happy to start our sales.
Excellent. Congratulations. That's very exciting. You guys, at the end of the panel, we're going to have some time for questions. So definitely start jotting down or, taking a mental note, some questions that you might have for our speakers here today. And I like to break down the panel in 3 parts. One, kind of setting the stage, getting the speaker's perspective on the topic that we're talking about today, and then going into more practical business applications and the entrepreneurial perspective of the market. And then we can talk a little bit more about the future and what they see, the vision that they see for what the future is building out in healthcare specifically. So the topic of this panel here today is around personalized healthcare. I would love to hear from the speakers. How do you define personalized healthcare, and what's the driving force behind its growth right now in the market? So, Samson, would you like to kick us off with that?
So I have my background in nutrition and exercise science, as I mentioned before. So that's where I kind of started my undergraduate and graduate studies and evolved that into more of the business application. And the lens and our thesis always was that we have so much data now. I look at our Apple Watch, our fitness trackers, genomics studies, gut testing. There's so much information, but as a consumer or as a patient, you don't really know how to make sense of all that, and clinicians don't know how to make sense of all that information. And so to me, personalized healthcare is being able to provide the right care at the right time for the right patient, based on the data that we're able to collect today. And that's really difficult to do. It's easier said than done, but we have so much data at our fingertips now that we just didn't have access to even several years ago, and it's compounding at an exponential rate. So to me, personalized healthcare is giving people the right insights about what changes to make with the right data sets at the right time, to ensure they get the right care.
And the more information we have as consumers or as patients, as people, we're really pushing and demanding for that kind of more detailed analysis on our bodies and healthcare. So that's really interesting to see. Igor?
Yes, I pretty much agree with Samson. For me, personalized healthcare, it's designing the care plan of the patient, considering not only the clinical setting, but also the social determinants like what is your diet, your stress levels, our environment that you are living, and also in the near future, like all the information from the devices and genomic information and epigenetic information. So having the ability to really design a care plan that have medical adherence for that patient in many levels, not only the clinical setting.
They have a cover mostly from the technical perspective of what a personalized medicine is. And I remember one article that I read a long time ago that said that your zip code is more important than your genetic code. So that's when I read that and say, my zip code is more important than my genetic. Yes, where you're living is more important. So that's personalized healthcare from one perspective. But raise your hand if you can send money to someone using your phone right now. If you want to send $10 to someone, can you use your phone to send money to someone? Okay. Can you send your electronic health care records to your doctor right now? No. Is that personalized medicine? Access is what is going to make us the personalized medicine and the access to genomics, but it's going to make healthcare more personalized. I don't care if I can track how many hours I have slept tonight, or how my heart rate is irregular, or my cholesterol is Y and Z. If my doctor today, according to my zip code, cannot see it, and if tomorrow I'm moving to Texas, my doctor in Texas cannot see it. So for me, personalized medicine is, for me, the portability of how I can take my healthcare to place. And that doesn't happen very easily in the United States. So that's a piece that is complementary to what my colleagues were saying.
You touched on one of the inefficiencies, right? I'd like to hear from each one of you. What are the inefficiencies that you are working to solve, and how are you working to solve them? So I know that, Bernardo, you're working with many potential inefficiencies, but if you want to specify, perhaps, are there specific issues that you're personally working with at Cleveland Clinic, specific inefficiencies, or is it more broad in your case?
Yeah, I will say that it's more the latter than the first one. It's very difficult to pinpoint and saying this is a specific topic that if we solve this is a bottleneck that is going to solve all our problems. We were talking with someone that this is a problem of the healthcare, the education in general. We do a test, and that test tell us, okay, you have this problem. These are 5 questions. Which one is the correct answer? I mean, this isn't one answer, but it can be different. It's very dynamic. It's very difficult to pinpoint one thing, because if today, for example, we solve the problem of scheduling, that's a very big problem. How many nurses I need today? How many physician assistants? Is this operating room going to be empty? How I can make it more efficient to have more patients operated to reduce the waiting time? This is a problem today. If you fix that, another problem is going to appear. So more than that, a particular point I will say that is having, now that I'm thinking, is more about the real-time access to data, that we have the capabilities, the technological capability, we have that. So from my personal perspective is trying to figure out how I can identify those unmet clinical needs and those problems in real time so I can apply solutions accordingly.
Samson, would you go into a little bit more detail in the inefficiencies that HealthSnap is tackling that are currently issues in the healthcare system that you guys are being a solution for?
Yeah, I'll just give I think the biggest problem that we see in inefficiency. I mentioned a broad range of chronic conditions, but high blood pressure is the number one killer in the country right now, cardiovascular conditions. It's called the silent killer for a reason, because most people don't even realize they have high blood pressure. The way that blood pressure is currently managed right now is, and if you've experienced this, you go to your doctor, they take your blood pressure one time, in the afternoon or in the morning, you probably maybe had already your coffee or whatever. They say, oh, your blood pressure is high today. Here's a medication. Here's your lisinopril or any blood pressure diuretic medicine. They send you home. You're now on that medication. They say, take your blood pressure every day and come back to us in 6 months. 6 months go by, your blood pressure hasn't changed at all, or maybe the medicine worked or maybe it didn't. Now they have to adjust the medication 6 months later, and they're reacting to the data. What we solve for is filling that black box between those visits. So imagine now you go to your doctor and they say, hey, take this blood pressure cuff, go home with it. When you take your blood pressure at home, a nurse will actually be able to see that reading in real time. They're going to get notified if it's in range or out of range. And if it's out of range still, then we're going to change your medicine remotely so that you can change your medication and we can manage it more effectively and more closely and more personalized. We're going to know every reading over time and see the trends. And then when you come back in 6 months, we'll review the last 6 months worth of readings and the trends and the anomalies to see if the medication and the care plan that we provided you with is actually working. And so I think that's a really good, simple example, but it's the most common one that we see where our healthcare system is reactive, it's episodic, and we treat a chronic condition acutely in a physical clinic. And for us, we're flipping that entire care delivery paradigm on its head and delivering a chronic problem over a long period of time and helping people get the care when they need and where they need it most, which is typically in their home or not in the actual physical doctor's office. So to me, that is the biggest inefficiency when it comes to just routine management of chronic disease. And I think we're at a really exciting inflection point where we have technology and payment parity with reimbursement changes in our government supporting the care delivery in the home and personalized care delivery in the home especially.
That's great. It goes in a little bit into my next question, but I'll loop back in a moment in regards to market impacts and how that might be accelerating some of the changes that you guys want to make. But first, Igor, would you share a little bit more detail about the work that you're doing to solve some of the inefficiencies in the healthcare system?
Oh, great. This is something that I learned into the aviation space, that is to make smarter decisions. The environment of extreme pressure, you should have time and you should have your best cognition ability at the time. So we are very focused on how can we create quality time for the physicians, accelerating all those nonsense bureaucracies that we have, not only accelerating clinical documentation, but structuring data in a way that don't create cognitive overload into the physicians, and trying to match in all of the clinical knowledge available, evidence-based medicine and clinical guidelines, and make it then smarter to the physician to help the decision making. So we're trying to create time and to enable them to make better decisions for the patient.
Yeah. Have you guys seen specific things in the market that perhaps us who are not immersed in the healthcare world that have either been accelerating or supporting the direction of integrating innovation into the healthcare system?
Two things. One, I think just the technology itself is becoming a lot more connected and accessible for actually the consumer, which is us as people, to be able to provide it to your doctors. So it's kind of a bottoms up approach, but there's a real challenge with like infrastructure right now that you mentioned about just the ability to share records between doctors if they're on different medical records. So there's a really big challenge right now that there are integrators trying to solve for. And we've actually been trying to solve for that too, where through our applications, everything integrates to your doctor's EHR, your electronic health records, regardless of where you go. It's a really big challenge to solve for, but there is connectivity happening now, and I think we're making progress there, but it's slow moving progress.
Can I ask a follow-up question too? So what will need to happen for, in your perspective, for that to happen rapidly and in the pace that you will feel that is comfortable for you to say, now we are making an impact?
Yeah, I think there needs to be the ability to have like a standard API data set across the EHRs right now, which they're trying to do, not to get too technical, but they're trying to do that with Fire, and it just didn't work the way it was supposed to. But I think as a consumer, you'd want to be able to say, if I go to this doctor or this doctor, and they're literally 5 miles apart, but they're a different health system, I can have the ability to share my records with both them because the EHRs are already talking to each other in a centralized patient record. Apple's trying to figure that out, I think, right now, but it's been a challenge with the back end because the EHRs, like Epic and all these electronic health, they don't want to share your data across because that data is highly valuable to them. So to me, it needs to come from industry like a Cleveland Clinic to say, hey, Epic, hey, Cerner, hey, these big companies that have been behemoths for long times, you guys need to play nice in the sandbox, or else either the patients or the consumers are going to demand it. And I think there's going to be a forcing function at some point in the near future.
Final follow-up question. And who is managing all of that?
The connectivity between the EHRs? Yeah, I think that needs to be an industry adoption.
Insurance companies?
Absolutely not. No. I think there needs to be mandate to have data sharing.
Government
Government is a step, but...
See where I'm putting right in the corner, right? I'm trying.
I think government is a step to mandate. They require it with high tech for EHR availability in the first place, but they were designed for billing at a certain point instead of patient care. So I do think there needs to be some mandate to have some standard of connectivity, yeah?
Interesting.
For me, we have an increased experimentation incentive, so everyone wants to try something new. But also this creates a problem with all the hype of artificial intelligence, that broken promises. Every day we have a new AI that promises to beat doctors. And in matter of fact, it's just someone plugging into ChatGPT and getting it working to some very basic case. So this creates a lot of noise in the market. So it's very important to separate what those who are seeking scientific validation of the solutions from those who are trying to do fast fermentation, which is good, but we must separate the solutions between something that must actually get into the clinical setting with actual patients, into the real life, that can harm the patient, from those who are just doing some very fast prototype or proof of concept of something new.
Yeah. Each one of you are tackling inefficiencies in different ways, which I think is exciting for our conversation here today. It'd be interesting to hear a little bit from the business perspective. What have been important partnerships that have been fundamental to being able to really take your business and have a successful go-to-market?
Yes, we talked about the barriers of adoption that the EHR companies or the insurance companies build around the data. So we found very strategic for us partner with big techs, because they're kind of a part of a problem, so they must be the part of solution. So we partnered with Oracle, we partnered with Meta, and they got like a very interesting ability for us into how can we optimize the model. And by principle, we did the partnership without vendor lock-in, but this in fact accelerated our pace of development. So instead of looking at enemies or someone that might block your development, you can partnership with some principles, and this can accelerate a lot of your development. So, and this is funny because Oracle has Cerner, they have their own clinical assistant solution, and we were with Oracle Cloud World in the stage presenting together. So more in the sense of collaboration with the new startups and the already established big tech, and we were with their research team together. So partnerships are a great way to overcome that barriers.
Excellent. Samson?
Yeah, I mean, working with providers specifically, it's highly regulated. There's insurance companies that dictate whether federal or state commercial insurance companies. But I think one of our most successful and impactful partnerships are like American telemedicine consortiums that actually work with policy at the federal and state level. And we're able to demonstrate and show them that there's clinical efficacy with technologies like the ones that we deliver. So actually showing, hey, monitoring blood pressure or sugars or weight remotely is a better, a more effective and statistically evident way to manage chronic conditions than the standard of care. And our ability to demonstrate that clinical efficacy and use evidence in peer-reviewed publications, working with policymakers has been our best partnerships to be able to make a long-term sustainable impact in the way that care is delivered for us so far. Yeah.
So on one end, you have the patient with chronic disease being managed, and on the other side, you have the physician. Did that partnership facilitate that barrier of entry with the physician?
It certainly helps because physicians are healthy skeptics by nature, and they've also been practicing medicine for decades ahead of time. So imagine going to someone that's been practicing primary care for 30 years and telling him, hey, Dr. Jones, guess what? You've been doing it this way for 30 years, your whole career, but now we're going to do it this way. Dr. Jones is going to look at you and go, get out of my office immediately. But the health system is saying, this is the way we're doing it now, because if we don't innovate, if we don't do it this way, our patients will leave us. So I think demonstrating the clinical evidence for a physician, demonstrating that it's going to be easy and that the patients are requesting it, most importantly, is the way that we've been able to do that with policy supporting that in the background.
Excellent. Bernardo, how about you? How have you guys worked with partnerships to be able to build out more innovation from Cleveland Clinic?
We mainly create we are lucky enough to have a lot of or enough people from inside Cleveland Clinic to develop technologies and to commercialize it and go to market. And I think that the common ground that they are mentioning is identifying a clear unmet clinical need, identifying what is a clear problem that you want to solve. I want to measure continuously, effectively, with clinical background and a clinical evidence, how your blood pressure is regulated at home, and I want to regulate the medication that you're taking. That is the problem that he identified, and very clear. Even if that doctor that has been doing that for 20 years, if you're going to come to that doctor and say, I'm solving this problem for you, that doctor is changing that behavior. It's going to take time, yes, but it's very difficult, as you mentioned very well. If you have the background and the support of the policy saying, we are going to reimburse you if you use our technology. Now, if you don't have that reimbursement attached to what you're saying, forget it. You went through the FDA, you did your clinical trial, you did everything. If you don't have that piece that is helping the reimbursement to the medical doctors, it's very difficult to pinpoint or say, this is the thing that is going to be the most effective. So from Cleveland Clinic perspective, we first focus on the unmet clinical need. And it's not like we don't care about the future, but if you are improving our patient outcomes, we will support that technology moving forward for sure.
You are the partner, right, for the innovative solutions that are coming through Cleveland Clinic, right? So you end up being kind of that instrumental role to help those internal caretakers take the route towards innovation.
I'm the bad guy then killing their dreams and saying, no, we are not going to give you the money.
Every entrepreneur needs some pushback here.
No, but we are happily, um, very proud of this, how to say, tough love, if you want, that we put, because, I mean, it's an investment. It's very difficult to say. People believe that we are saying no because we are, I don't know, selfish, or we believe that we know better than them. But we create a team. So let me give you an example. If you are coming with this bottle and you want to commercialize it, I'm going to be the first person spending at least 8 to 10 hours doing market research, intellectual property assessment, everything. I'm going to talk to you, and then I'm going to take it to another team, and that team is going to do a really curated market access, intellectual property assessment, then a technology development saying, no, you cannot use this material, you should use this material. And then a business development person saying, yes, we have 3 partners here, 3 partners there, but they're not going to pitch more than that. And after that is taking 3 months, we'll make a decision. So it seems very long, but 3 months to make a curated decision for that.
Yeah,
I think
absolutely. So as you guys have see, we're already transitioning more towards the business application part of our panel here tonight. So I'd like to take a direction to talk a little bit more about finding the problem, right? Which is a lot of what we've started to talk about here today. What is the first step to finding the problem and finding that product market fit? Perhaps, Samson, if you want to kick us off.
Well, first of all, I'm just curious, how many people are entrepreneurs building in the crowd right now? Can you raise your hands? Okay, so almost half. I think the biggest thing that a lot of entrepreneurs typically do is they build a product without understanding what problem they're solving for in a very specific niche market. And that all comes down to talking to your customers or your prospects and understanding the jobs to be done. So if I'm doing a problem analysis in a market, you mentioned it, right? You really have to actually know their problems more than they do, because you're not going to be able to build a solution for them unless you actually truly understand what does a day in the life look like for that end user, what specific problems do they actually have for that specific use case, and then you build from there. So to me, if you can solve for that in a very niched market first and then expand from that, it's the way that you can start identifying, do we actually have some product market fit? Product market fit also for any entrepreneur is a very, I think, misguided misnomer, and honestly, I think confuses a lot of people, because especially in the early stages, like who's in pre-seed, seed, Series A, who's pre-seed and seed right now? Raise your hand. Who's Series A? Anyone past Series B? Okay, so as everyone can see, mostly early stage founders. Product market fit in the early stage is not hitting a revenue milestone. And that's misguided, because you're going to say, oh, when we get to $1 million in recurring revenue, we found product market fit. But the reality is that a product market fit has to do with multiple things happening at once. It's a market that is growing and that you're solving a specific problem for. And if anything, in the early days, product market fit is not the most important thing. If I'm sitting in the shoes of an investor, founder market fit is actually the most important thing. Are you going to be the person in the early stages to build for the next 10 years to solve that very specific problem with a very specific solution, and then be able to identify that market evolution over time to maintain product market fit over time? You don't get it and then maintain it. You have to continue to iterate within that changing market to maintain product market fit over time. And the only way to showcase that is that you have reproducibility and efficiency at scale. And so as an early stage company, it's all about identifying if you are the right founder to build in that market, that you know the market and the problem intimately more than anyone else, and that you're that person that should get the venture capital money. And that most importantly, as you scale, you're able to show you can maintain that product market fit through repeatability, reproducibility, and efficiency as you hit those inflection points of a business.
Excellent. Very good. Igor?
Yeah, 100% working closely with the customers and developing the ability to pivot fast. In our early days, we developed a module for bedside support, and no one wants to use it. So then we went to the surgery centers. No one wants to use it. So we were iterating fast, and found our early signs of market fit in telehealth. And recently we were discussing with the urgency care, and the doctor said, I don't want your module to interfere with the appointment, but I do like at the end to suggest something to the back office, to more intelligent routing and to lines of care optimization. So definitely working with a customer as one team, iterating fast, and especially in healthcare, it will take longer. It's a different industry. You should remain into the market. You cannot be drained by cash. So you should be alive to try to iterate until you find how it works.
Yes, super important perspective if you're going to jump in the game, because patience, super important for business and seeing those results. How about you, Bernardo?
Yeah, so they said, I really like the jobs to be done framework from Clay Christensen and Tony Olwick, but that's when you start talking to people and just start seeing that you're asking questions, open questions, you let them talk. Let's just don't go with your solution. If I'm asking her, well, when was the last time that you faced this problem? And just let her talk and she will guide you there. Just don't rush into saying, but I have the solution for you, and that she will tell you something. And if you start seeing a pattern, 5, 6, 7, 8 people telling you the same, you're into something. That is where you start to say, 2 people told me exactly the same. It's not about the eureka moment. It's about that's funny. When you start seeing a pattern, pay attention to that. That's the only thing I will add to what they say.
So once you actually have product market fit and you've started to generate interesting traction and revenue, how does the sales process work in healthcare? It's different, right?
Does it work?
We're going to find out right now. So tell us a little bit about the sales process in healthcare and how it's different from the other industries and what to expect in that process. I'll let any one of you jump in.
I'll start with a big corporation and a big enterprise, because most of the people, they come to me, and rightly, I've been there, done that, we want to sell this to Cleveland Clinic, and it's very difficult to sell to a big enterprise. Like if you want to go to Google, if you want to go to Amazon, if you want to go to Coca-Cola, it's going to be very difficult sell, because you need a physician champion in healthcare. That is the person that first will need to do a pilot. That pilot is going to take time from that physician to do the IRB process, that is their protocol in order to create to fulfill all the requirements to do a clinical trial or a pilot or whatever it's going to be. Then the startup will need to pay for that, because you need a research associate, you need a project manager, you need to pay for that. So you use the facilities of the clinic. And that takes approximately minimum of 9 to 12 months. And just to do a pilot, I'm saying that you're not even in the proximity of selling one unit of your product. So my recommendation will be perhaps to start going to a place where you can actually talk to the person that is going to sign the check, or at least very close to that, meaning a small clinical practice where you're talking to a doctor that is the CEO at the same time, and say, well, you know what, we're going to do a pilot, but in 6 months I compromise that we're going to buy 6 units of whatever you're saying. It's unless that you have the bandwidth and the pockets to wait for 12 months to sell to a very big healthcare system, and a physician champion that is going to be doing all the heavy lift, it's complicated to sell to a healthcare system.
Go ahead.
Healthcare is not one size fits all. Very early on, I was taught the acronym, the 4 Ps of healthcare. Have you guys heard of that? You're the 4, yeah. So the 4 Ps of healthcare is something that always stuck with me. Is when you're innovating and trying to sell into healthcare, and that's providers, pharma, payers, employers, or patients. So direct to consumer. That's 5 really, but and you have to be really thoughtful around who you're selling to within those markets, because they don't buy the same way. They have very different jobs to be done. They have very different incentives along the continuum of how healthcare money flows. And it's very difficult to build a solution that works across those, especially as an early stage company when resources are finite and when time is your complete enemy. So to me, understanding first who you're selling to, because you should not be one size fits all. Like if I see a website that says we sell to pharma and employers and payers, I already know that they don't have meaningful traction, because you cannot do that at an early stage company. So pick one, stay there, and pivot from there, but try to go an inch wide and a mile deep, first of all. Within those segments, though, for us specifically, I can just talk to our experience. We started at the small and medium-sized physician groups. We were always focused on the provider market. That was our thesis from day one. We never came off of it. And we were able to work with one doctor groups or two doctor groups when it was a husband and wife couple, and we would go in the practice, and we'd drive around all of South Florida, and we'd learn every single little thing about their practice. It was not scalable, but we learned a valuable lesson about what it was to be iterative and learn what it actually took to make this be implemented and work, even at a one doctor group. And from there, you get your 5 doctor group, and then your 10, and then somehow you're in front of a 40 doctor group, and then all of a sudden you got your first health system, and you go, oh my God, we've made it. We have our first health system, but be careful what you wish for, because it's a 3-year sales cycle. They will ask for a free trial or some beta period, or even a paid trial, which is our hard nose. We don't do any of that. And we never did, because that's the death of a startup. And ultimately with a health system, you have to be really careful when you get to that point, because when you get your first one, you obviously can forward that into the next 3 or 2 or 5. But when you get into an enterprise, it's very slow moving. You need to understand who you're talking to and map out the stakeholders. You have clinical champions, you have financial champions, and then you have the people that are behind the scenes that are influencing this. So in a health system, you have people who are doing billing. So you have revenue cycle, you have legal and compliance, you have IT and infrastructure. If you don't expose yourself to all of that and understand what their involvement is in a project for your solution, you will be either walked out the door when you get in front of the CTO or CIO or CMIO, or you're going to have to figure out a way to understand how to work with them proactively. And that's something that we learned early on just by failing and losing a lot of deals. But if you understand each of those components up front, you can proactively address them with your solution and make sure you understand how they all work and what their responsibilities are.
Samson, did you build out a lot of your advisory board and even the venture capital that you brought on based on what those needs were that you needed for HealthSnap?
Yeah, I mean, all of our early advisors were either physician executives from health systems, and our board members were solely healthcare investors. And we did that intentionally, or independents that were our or former healthcare executives. So like SVPs of population health at top 10 health systems. They understood intimately the jobs to be done across those roles. And that's another whole conversation, but who you raise capital from can make a really big impact, because they're just going to say, oh, why? What do you mean you haven't closed Cleveland Clinic yet? I thought you've been talking to them for 3 months. Or they don't understand how long and how much work it takes to just get a contract signed, let alone another 6 months or a year to implement it and see meaningful revenue. So having the right investor fit to support our objectives is really, really important too. So we had really great guidance throughout. Yeah.
That's fantastic, because I know that venture capital money comes with a lot of pressure. And if they can understand the pace of your business, that's going to make for a healthier relationship with your partners. Igor?
Yeah, we're still starting our go-to-market here in the US, and we chose exactly that path. We sold to a small practice, and this is great to understand the market and to test the solution. So it worked and very fast into our go-to-market. But I think also that enterprise can teach you a lot, and it's very, very different to sell from small, medium business to enterprise. And it's very important to understand that you as a startup have a very key asset that is speed and innovation. So if you can identify into an enterprise some very strategic asset that you might leverage, you can be very creative at the business module and the pricing module. So sometimes you can beat all of the competitors in price performance equation. Sometimes you can work like if your valuation increase, you can sign a contract and sometimes share something of the success with the enterprise. So I think you can separate your sales process between small to medium business to enterprise and position yourself as a strategic asset, because you can have like champions in the industry, in the technology in your startup, and you have an unmatching speed of product development. So if you like position yourself as a key partner, perhaps, or in our case, like scientific publications together with the customer to help them to position in that specific market. So you can be very creative and gain those strategic enterprise accounts. That is great for a position with the small, medium businesses.
Excellent. I'd love to to talk a little bit about the venture capital side of the business, because I know that there are always entrepreneurs in our community that are looking to raise money as well. So I'd like to direct this question specifically to Samson. How has venture capital impacted your company, and when did you know that it was the right time to pursue it?
Similar to like working with an enterprise customer, raising venture capital is not the finish line. That is the start line. And a lot of entrepreneurs try to start companies because they're like, oh, I'm going to start a company and then we'll raise all this money and then we'll figure it out. To me, I think the most important thing is recognizing that venture capital is rocket fuel for your business when you're ready to fly to the moon. But if you raise venture capital and you don't even have the pieces for your rocket yet, it's going to be a very, very, very difficult conversation to have with that investor or that board member. You also need to recognize too of like, what company do you want to be? Do you want to sprint and be the Uber and raise a lot of money and go public and go for the moonshot? Or do you want to go at your own pace and control your own your speed and do it for 20 years and make it a lifestyle business? There is no good or bad. It's a personal decision. And I think there's a lot, again, it's so sensationalized and so glorified to raise venture capital and go and start this massive multi-billion-dollar business. It's less than 1% of the time. 99.99% of businesses fail, even if they raise venture capital. So you just know that the odds are already stacked against you. The second thing for me about just like in general about fundraising is like I said before, in the early stages, it's all about founder market fit. If I'm sitting across from an investor, are they going to get whoa, this person has the conviction, the market expertise, and they're ready to dedicate the next 10 years of their life solely blood, sweat, and tears to build this business? And if they don't get that feeling from your first 30 seconds, they will say, thank you very much, but it's not the right fit for us. And so I think that's really important too, of like, it's not just a fun thing to do. You have to be 150% dedicated, and it affects yourself for 10 years and it affects the people around you. So it's really, really important to recognize that. Over time, as you do raise capital though, especially if you raise your first check, it's all about de-risking yourself. It's about saying, removing the founder piece first or the team piece first, then showing some meaningful traction, and then about reproducibility and efficiency as you scale at each stage along the way. And then also recognizing that not all capital is the same. So like if you raise from an individual, high net worth individual, or an angel group, or a venture capital firm, or a growth equity firm, or a private equity firm, they all have different expectations about their bosses, which is their LPs. You have to understand they expect a return for their investors. And as someone taking their money, you need to know what that is up front. And so you have to be able to have that alignment too with your investors. They need to have conviction that you're the right person, that you have meaningful traction, and that you're in a rapidly growing market that has some asymmetrical opportunity in a very unique window of time. And so that's why I keep talking about product market fit needs to be maintained as you raise in different rounds. And you might not have it when you raise your Series A, but you had it in your seed round. And so continuing to show that over time, I think, is something that we've been able to do as we've gone through now our Series B. But now the stakes go up because we just raised a meaningful round. Our investors have a certain expectation about a return now in the next round, and we have to maintain product market fit as we think about the next phase of our growth. And that's an ongoing increasing burden as you get to a certain scale, that again, you have to be able to be in it for the long run and the long haul. The last thing I'll say is like, you're going to get more no's than yeses, so just expect that. It's not personal, and just keep moving. Don't take it emotionally. If you're going to have to rate, like, especially earlier rounds, you're going to have to pitch literally hundreds of investors. You're going to have to go to every conference and do the networking events and ask them if they have intros for you. And just be a rapid learner and iterator and say, hey, like, how did this rank compared to other companies in our space on a scale from 1 to 10? And ask for that feedback. They're willing to give it. And what would you want it to have heard to be able to move to the next stage? So like asking questions like that to investors is really important, especially as you get your reps in. And also like, don't waste your first couple of pitches on your ideal investor. Waste them on ones you don't care about. Not waste, but use them on the ones you don't care about as much, so that you can fumble and mess up, and it's not going to be perfect. But it is about relationship building, and that's something I was taught early on.
That's great. No, I appreciate that insight. Bernardo, Igor, have any comments that you want to share on the topic?
Yeah. At Sofya, we choose the path of being self-funded. So the first company that I founded is still funding Sofya. And this is my recommendation, like treat others people money like your own money. So we are being very strategic at the best time to raise, and also develop the relationship with the investors, because at the end of the day, it's all about relationships. It's all about building something special and not about the money you are raising. The money is the fuel to do that, like Samson said. So and have the expectation on giving financial returns on the investment. That you are a financial product as well. You are a startup company, a product for the patients, but you are also a financial product for the investors. So be aware of that and develop relations with your network.
Super good. Good. Okay. Let's transition a little bit towards the future. How do you guys foresee innovation in healthcare evolving in the next 5 to 10 years? Perhaps even 5. I think things are moving so fast right now that 5 years could feel what the past 10 years have felt like. Is there anything that really stands out to you guys?
I'm biased, but I think that in 5 years from now, or less than 10 years, so probably in that range, I do think that there's going to be a lot more connectivity and access with your physicians. I do think we're compounding at a rate now that is different than we were before. Just like advances in like electronic health records have only been around for how long? 20 years, yeah, it's a year. Yeah, 20 years. But so I think the technology that's being implemented now around that is going to make us have a more connected healthcare landscape. And I think a lot of healthcare will be delivered in the home for routine needs. And you'll be able to go onto an app, or at least have an insight to know whether you need to go into the physical office instead of our standards of care right now, which are very routine and physically in an office. So there's going to be a lot more patient consumer empowerment to take control of your own health with personalized data, and a lot more oversight by clinicians to help you routinely engage with your clinicians when it's needed most.
I see more smarter clinical workflows, because right now we have a lot of intelligence during the consultation, but I think we will have more smarter pre-consultation workflows and post-consultation workflows. And I see the integration between the social determinants of health in clinical settings, and also the integration between biotechs and the companies that are delivering digital health solutions. So right now the biotechs are spreaded and the information are isolated. So the information will be integrated into the digital health workflows as well.
I struggle a lot making predictions. I don't like to make predictions. There is something that we are very bad at, human beings, is making predictions. My wife has been telling me we're going to have a market crash, and I'm still waiting for that. She has been telling me all the time, is going to be a catastrophe here and there. It's like there is coming the wolf, it's going to eat you. So for me, making a prediction is very difficult. However, you need to be prepared. I don't know if you ever read the book Anti-Fragile or The Black Swan.
I've heard of it.
Yeah, they talk about that. You can't predict that tomorrow is going to happen X, Y, and Z. Yes, you can predict that tomorrow the sun is going to go out. Yes, of course, but you don't know. So you need to be prepared. And the best way to be prepared is learning. And here you have two people that they know a lot about what they have been doing. So I encourage you just to keep reading, keep learning, keep trying, and that's it. Be prepared, so whatever is going to come tomorrow. Who was waiting for ChatGPT? Who was waiting for ChatGPT? Nobody. And one day you woke up and you were able to chat whatever to ChatGPT and spit out. When were you waiting for Google? When were you waiting for iPhone? You did it. Tesla. Those stuff, they appear. And my last example is I think it was in, I don't know which part of California. One day they woke up with these scooters, and then they said, oh, now I have a scooter to go from point A to point B. Fantastic. But what are the logistics regarding that? Who is going to pay for the insurance of that? Health policies behind usually technology, they are going very slow compared to technology. So that's the only thing that you can be prepared. So that's my two.
Very good. Thank you so much. And I want to wrap up our panel before we open to Q&A from the audience. We'll be able to take a couple questions. Community is really important to the entrepreneurial ecosystem. It's what we're experiencing here today. And I'm sure that's no different for each one of you in building out solutions for healthcare. How do you see community being a part of the solution, be it in a sense that you've experienced personally, or you see a need or an opportunity for?
So what she's doing is, I encourage you to do the same. the best networking that you can do, create your own one. Go to the same to a bar that is close to your house or whatever, and if you have an idea and you want to meet people, the best networking that you can do is create your own networking event, and you will learn 10 more times than coming to this fantastic event. It's not that I'm downgrading your event. It's fantastic. I work remotely. I work full-time remote from home. I go to Cleveland quarterly. Next week I'm flying to Cleveland, but I miss this coming into person and talking to people, and this is, I wouldn't say that is important. It's perhaps the most important thing. At the end of the day, we're human beings. I'm not a chat GPT. So that's my personal opinion.
Yeah, I think what I didn't personally have when we were starting the company was community. It was so apparent. And it was so apparent that when we were trying to find community, we literally had to fly to Silicon Valley and stay in Palo Alto for a week to join an accelerator. That's how little community there was in South Florida back in 2015. So it's amazing to see how far we've come to have an event like this and recurring events. But to me, it was always about learning from people that have done it before, and really just like putting your pride and ego at the doorstep when you're trying to build a business, because every entrepreneur respects every entrepreneur so much. And I don't care if you're the first employee and you just started yesterday, or if you're a multi-billion-dollar company, the best entrepreneurs recognize that it's extremely difficult and arduous and a long journey. And community is what makes you survive throughout all of that, because it is a game of survival. Like, I'm in it for 10 years, and there have been many times when I've been like, I'm done. I can't do this anymore. I'm going to quit. But because you have either a co-founder or a partner or a community of people that you can rely on, like advisors or board members, that keep you going around, ultimately around a shared belief. And in business building, specifically for me, the number one question I ask every single new employee on their first week is, what's your why? Why'd you join the company? Tell me a story about a family member that had a similar experience that my grandfather did, because I guarantee you, when it gets really hard, you'll think about that person, and it's going to make it all worth it in the end. And that's what I think like building businesses is all about. And I think that's why community is so special and important, whether within a company or around collective companies that all have similar ambitions over time.
Thank you.
Rick, I never did anything alone in my life. And the best advancements of every business that I have started with relationships, started with alignment of values, it started with a dream. So having a community is the best step, it's the best part of having the conversations and aligning with people. And in my personal case, I just flew from São Paulo, believing in our ability in the bioinformatics spaces and AI, and the economic environment here in the US can be better for us to deliver that dream of personalized medicine. So how can I do that without a community, without people to learn from and to try to give first and show myself and try to collaborate, and then hoping that the good will happen. So communities, they start in the end of everything.
I couldn't agree more. Thank you so much. All right, so we have a couple of minutes to open for Q&A. Zach here is going to have a wireless microphone. So if you want to raise your hand, Zach will call out on you.
All right, so hi. I'm trying to ask about the reimbursement model in this country with, big insurance, et cetera. How has that stymied innovation in this country?
I mean, for us, it's been a major unlock and tailwind for us, candidly. I mean, reimbursement as a whole has been going down for like primary care providers, but there is a whole new landscape of reimbursement opportunities for healthcare providers that our market adopted and grew within. And that's all remote patient monitoring and chronic care management, and a whole new care delivery model of care management opportunities. So again, the reason why your doctor wasn't monitoring your blood pressure remotely is because there wasn't reimbursement. You have to follow the money and the business of healthcare for the doctors. They didn't have the financial incentive to do it. Now there is, which is what's creating such an exciting opportunity for us. And this is a federal, it's through CMS. So Medicare is reimbursing this, and all the commercial payers are now starting to reimburse for it. And we have a snowball effect. And it takes the ability for us to show the clinical evidence to maintain that and continue to expand it over time.
Can you buy me a drink?
What a question.
There are two ways that you can create a CPT code. A CPT code is a code that when a physician or nurse or someone provides a service, you write that it's going to billing, and it's different code, reimbursement, payment, and coverage. That's because I asked for a drink. It's very complex. There are two ways that very simple. I'm going to put it very simple. There are two ways that you can create a CPT code. You say, does a CPT code already exist for a technology that is similar to mine? Meaning, when he created his remote monitoring thing for blood pressure, perhaps it didn't exist as CPT code. So you need to create a CPT code from scratch. That is extremely complicated, at least $150,000, at least $150,000. You need to hire a consultant. They need to find a way. You need to create the clinical data. You need to submit it to the AMA, that is American Medical Association, blah, 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 blah. You see why I'm asking for a drink. And then the other way is to say, oh, this CPT code already exists. Can I piggyback on this CPT code and say that my technology is already doing like this? And I say, perfect. If you can do that, the problem is that CPT code may say the reimbursement, that what the payment that you receive is $10, let's say, right? $10 for this bottle. However, it costs you $25 to create this. So you are minus $15. See where the problem is?
But I have two questions in one. First of all, what were your challenges in the first 2 years? And second, how did you manage to get capital investments?
My first challenge is finding the right use case, because sometimes the use case is good, but not impactful enough to build a business around. So keep pivoting you found some great impact. And our second biggest challenge is to build a team, like a very good team around your vision and beliefs and your values. And financially, I think our situation is a little bit different because we choose the path for having one company investing in another company. So, but my general advice, especially in early stage, is to be very conservative with finances. So being very aware of the long run of healthcare. So this worked for us.
Two biggest problems were we couldn't sign a single customer when we started the business in the first couple of years. And that goes back to me, like we were trying to be everything for everyone. We were trying to sell into self-insured employers, and we were going to cash pay doctors. There also wasn't reimbursement for what we were doing. So we were like, we're like, this is helping people. Why is no one buying this? The doctors, it's helping. It's better to, it's good for your patients. Couldn't care less. We got zero traction. So we had to pivot, and then reimbursement started to be created literally within year to year. And then we had an unlock, and then we realized, okay, wait a second, let's focus in right now. And then we started getting a little traction there. And then that traction led to our ability to raise our initial friends and family round. So we started friends and family, and then we did an institutional round first. But we were very thoughtful around raising as little capital as possible to allow us just to get to the next milestone, to de-risk us, to get to the next financial raise, and so on and so forth. So we were very, very capital efficient early on.
And that wraps up another episode of the Founder Tactics podcast, recorded live at the Fort Lauderdale Tech Meetup. And if you're ever in town, please come join us at the Fort Lauderdale Tech Meetup. We get together once a month, and you can see our dates and register for the next event by visiting fortlauderdaletechmeetup.com, or just visit our Instagram page, FTL Tech Meetup, so that you can get some behind the scenes videos, interviews, and learn more about our community. Thanks again for joining us, and have a great day.